Beams, y'all. My name is Andrew Defy, aka the Gorilla Poet Laureate, aka the Hoodie God, aka Spitting Quarantino, aka I wear my sunglasses at night because my eyes are as sensitive as my heart is, y'all. And we are back for another episode of the internet's favorite community health live stream where we hit you with some of the latest medical news and interview leading health professionals. Tonight, we are going to be joined by Paula Villescaz, president of the San Juan Unified School District right here in Sacramento, where I am. She also serves as the Director of Legislative Advocacy for the County Welfare Directors Association. Paula is the former Assistant Secretary at the California Health and Human Services Agency and has been involved in some really high-risk efforts to fight COVID throughout the pandemic. We're going to talk to her a little bit about that tonight. And we're also going to talk about some new data exploring how the pandemic has affected toddlers, critical race theory, and some of the science behind vitamin supplements. Stay tuned. It all starts now. So y'all know we always started off with the weekly Rona update. And this week, case and death counts far below the peak. Tallies are at levels not seen since the early days of the pandemic. On Friday, 40 of the 61 agencies reported new numbers, and together they only tallied 1,648 new cases and 19 deaths. Vaccinations are widespread but slowing. 58.6% of the population has received at least one dose, and the hospitalization surge has receded. There are 1,071 people hospitalized with a confirmed case statewide. That's a 12.6 increase from 2 weeks ago. Something to keep an eye on, nothing to be too worried about. We keep it short when there's not much to report. We are keeping an eye on the Delta variant for you as California continues the opening process, and we'll have more on that next week. So this story comes to us from Leah Gullett at the Kaiser Health Network. For toddlers, pandemic shapes development during formative years. How is the pandemic affecting toddlers? Daycare and other child care providers said they are relieved to see COVID cases drop as vaccines roll out across the United States. But even as the nation reopens, mental health and child development experts wonder about what, if any, long-term mental health and development consequences young children may face. In the short term, medical and child development experts said the pandemic has harmed even young children's mental health and caused them to miss important parts of typical social and emotional development. Besides not being able to get as close to other people as usual, many young children have seen their routines interrupted or experienced family stress when parents have lost their jobs or gotten sick. The pandemic and its economic fallout have also forced many families to change caregiving arrangements. Coronavirus is impacting children and families in many ways mentally. The biggest and most obvious way is in the children's structure and routine, said Dr. Minnie Tandon, an associate professor of psychiatry at the Washington University School of Medicine in St. Louis. Young kids thrive in structure and routine, so when you disrupt that, things go awry pretty quickly in their day-to-day lives. Child behavior experts pointed to a number of problems exacerbated by the pandemic in a National Center on Early Childhood Health and Wellness webinar last year. Separation anxiety, clinginess, sleep issues, challenges learning new information, all included. Children have also shown regressive behaviors, wetting the bed even though they've been potty trained, for example. In March 2020, the Early Childhood Development Action Network, a global collection of agencies and institutions promoting child health and safety, put out a call to action shared by the World Health Organization, saying they were concerned about the pandemic putting children at great risk of not reaching their full potential, because the early years are a critical window of rapid brain development that lays the foundation for health, well-being, and productivity throughout life. To help kids heal, the Centers for Disease Control and Prevention suggests families make sure that kids stay connected to relatives and friends. The agency also advises that parents do their best to recognize and address fear and stress in themselves and their kids and seek professional help if needed. CDC experts suggest parents talk about emotions and provide opportunities for children to express their fears in a safe place. While we're talking about the Young Life, our guest this week is the president of the San Juan Unified School District right here in Sacramento, where our lovely broadcast studio is. She has been involved in COVID efforts throughout California, including setting up COVID-19 testing efforts and launching the Great Plates program, which served over 20 million meals to seniors statewide. She was also out helping immigrant and refugee fam at the border. Welcome, Paula Villescaz, to the show, y'all. And we are here live with Paula Villescaz, the president of the San Juan Unified School District here in Sacramento. So excited to have you. First off, how are you doing?
I'm great. I'm excited to be here. Thank you for having me. It's been a bit of a crazy day, and so I can't imagine anything better than to top it off here.
Hey, so we want to start off. You've been an incredible advocate in the fight for increasing access to healthcare. What experiences led you to become interested in healthcare reform in the first place?
I think like a lot of people who kind of really get into the space, and particularly with someone like me that's really made it my entire career, a lot of it is pretty personal. It goes back. I mean, if you go way back, just in general, growing up in poverty, my mom working multiple jobs, single parent household, healthcare access wasn't something that was just kind of readily available, but it really came to a head when I was in college, actually. So first person in my family to go off to college, which was great, UC Berkeley, go Bears. And while I was there, actually, the spring of my junior year, I was very unexpectedly diagnosed with a rare and aggressive cancer. And so it was also a pediatric cancer. So I had just turned 21. It was the first time really dealing with a significant health crisis. And so not a rare cancer, but I was the bit of an overachiever that I was already metastatic by the time it had been found. And even just kind of, originally the beginning of that experience, going to a healthcare provider and then initially being dismissed of, oh, you're a healthy college student, it's fine. And then, months later, finding a metastatic, rare, aggressive cancer with a very, very limited chance of survival was a really, really challenging experience. At the time, I was working 2 jobs to make my way through school. And that was right before and really throughout the season of the Affordable Care Act being passed. And I became, because I became a really strong advocate and spent the time that I could advocating for the passage of the Affordable Care Act, as particularly as there's a group of folks called the Young Invincibles. And it was this idea that young people didn't feel like they needed coverage until they came across a catastrophic illness such as this. And then at that point, it's a little bit too late, right? And so a lot of that experience informed my ultimate decision to kind of go into healthcare policy. I am, of course, in remission now, but that has had lifelong effects, and everything from having now kind of a preconditions and being kind of placed in that category to lifetime benefits caps, etc. I had to fight that every stage of the way because it just wasn't part of our healthcare system yet. So that's how I got involved.
So from your experiences, both as a cancer survivor and as a public health leader, what kinds of barriers, can we get specific about what kinds of barriers are preventing Americans from accessing healthcare today?
Yeah, absolutely. First and foremost, it's access. And obviously here in California, where we do have the Medicaid expansion, which is one of the single largest expansions of healthcare coverage in a generation, a lot of states didn't vote to expand Medicaid coverage. So that alone has resulted in significantly poorer healthcare outcomes in states where you don't have that expansion. But even in states like California, where we did expand coverage, and we do have near universal coverage, there's still a small percentage of our population that are not covered. But figuring out that coverage doesn't mean healthcare. Just because you have an insurance card or a Medi-Cal card that does not automatically translate to your ability to find a doctor, to have a trusting provider, to build a meaningful relationship. And a lot of that goes down to both, it's in addition to coverage, it's access to that coverage. And then it's finding the appropriate type of care with a cultural humility that invites people to keep coming to ultimately take care of themselves. And so those are some of the things that I view as significant barriers. And then, of course, there's just still the cost. Even with coverage, there's still a cost associated, and particularly when wages have not kept up with cost of living, that is a significant barrier to accessing healthcare.
Well, and some people oppose policies related to increasing access to healthcare because they believe that it will decrease quality of care or result in longer wait times. What would you say in response to these kinds of arguments against healthcare accessibility?
All of that is frankly complete nonsense, because what people have to realize is we as a society bear the burden of healthcare costs no matter what. And so we can either pay for it in prevention and access, or we can pay for it on the whole through healthcare premiums and rising costs of healthcare once folks are so ill that they then have to show up to the emergency room. And that really started to hit home actually when I joined the school board, because of course we have to kind of watch budgets. They're really important. But on the whole, like whether our employees see go and access healthcare at the beginning and in a prevention and a wellness space, or if they see it as, once things have progressed to be really, really acute, then they're an emergency care cost. No matter what, the cost of that gets borne by the entire group. And that's just that's a microcosm of how we operate as a whole. No one is spared from these costs. And I believe that we should do what the right thing is, which is provided on the front end in prevention and access so that people can live healthier and more fulfilling lives.
And so I want to pivot a little bit to the pandemic and how you spent the pandemic, because while most people would want to stay away from areas that were really hard hit by the pandemic, you went directly to these communities. Right? From a cruise ship infected with COVID to setting up testing for refugees at the border. Can you tell us what motivated you to help out areas hit hardest by the pandemic despite the risk to your own health? What makes you a superhero? Where do you summon that from?
Well, first and foremost, I wouldn't adopt the title, right? Like there were people who were actually on helicopters taking out some meds, right? Like those are the heroes. And behind those heroes, there are everyday public servants like me who support them. And that really opened my eyes. Like it's not just one person. It takes an entire team to stand up and say, like, if not us, then who? And that, having grown up in a single parent household where most of the time we were reacting to the conditions that happened to us and had very little power or had very little say, I know what it feels like to feel on your own and to, just be left out to fend for yourself. And so when there are people who I know, like particularly when there were moments, right, where we knew the federal government wasn't going to step up, and we looked around and said, wait, who's going to do this? And then realized it was us. Like it wasn't even a second thought, because if not us, then who? And we had a responsibility to our neighbors, to our fellow citizens, but also to our fellow non-citizens to treat people with compassion, with respect, and give them access to services that they needed to survive. That's what it was about. Like it wasn't really an option, because that's just what you do for your fellow brothers and sisters.
I'm just going to throw out that if not us, who is actually the superhero's credence.
Well, there also just wasn't time to be like, hey, who's going to figure this out? Like, it's like, no, like you go. You're on deck. You got to run. Here's your here's your helicopter flight. Here's a bag. Get in the car.
Right. Well, and so before you were the president of the school board, you were the assistant secretary for the California Health and Human Services Agency. And as the assistant secretary for the California Health and Human Services Agency, mouthful, you worked on many social programs to improve the health of Californians. Can you talk to us about some of those programs and why they're important to the public health?
Yeah, absolutely. And I'll just say, shout out to the public servants out there pulling double duty. So I did both concurrently, because one is kind of just a hobby and then, doesn't necessarily pay the bills, but has my complete heart. And then the other one I also do because I really enjoyed that as well. But they happened concurrently. But while I was Assistant Secretary of Health and Human Services, some of the things that I'm proudest of, and it's I've got to kind of separate it a little bit between pre-COVID and post-COVID. I think like a lot of us do, particularly when we think about the last couple of years. But the things that I'm the most proud of, first and foremost, I grew up on benefiting from social programs and social benefits. And so while I was at Health and Human Services Agency, we had one of the biggest expansions of CalFresh, which is the biggest nutritional program in California. We expanded it to dependent adults and disabled elderly adults as well. So it was the SSI, SSP expansion. That's the nerd talk for it. But it basically meant that anybody on disability who could now get a food benefit, which was not the case prior. And in addition to that, we established the pandemic EBT program, which really was almost kind of universal food access program for children, while they weren't in school. If they qualified for other specific services, they could then continue to they were then automatically enrolled in EBT so that their families had money to eat. And as someone who relied on these programs, I got my meals at school. That was the most reliable place for me to get a meal. These basics around food security and just providing the basics for our families. Those were some of the most important things that I did. I think in addition to that, we did almost the single biggest expansion of the immigration services branch in the entire state. So everything from increasing DACA legal representation to providing legal services for undocumented minors, unaccompanied undocumented minors, the UUM population, particularly when we were in an environment where no other state was in a position to be able to accept our neighbors from across borders. Instead of just closing down our borders, we actually opened them up, and we did it safely, and we did it in a way that really did save lives. And so I'm really, really proud of that work as well. And then, of course, that's like aside from the pandemic response. Right. When I stop and think about it, there's just nowhere else I would have rather have been during a once-in-a-lifetime pandemic than setting up programs and services to directly help people.
And thank you so much from all of us for your work and the work of everyone that was out there. I do want to pick your brain while we have you here. As California begins to reopen and more Californians are getting vaccinated and schools are opening back, how are you feeling about everything? From as both someone who has the health background and someone who's now running a school board, so you're responsible for all these young people trying to get back into school. How are you feeling about it?
Yeah, it's a responsibility that I take very, very seriously, and it does keep me up at night, particularly right now. A lot of the pandemic response was evolving, and my emotions were evolving right now. And I will say, I even think like a month ago, I thought we were kind of starting to get to the end of the tunnel, et cetera. And now we're in this position with the Delta variant popping up, and it's just, this realization that particularly with the larger amount of vaccine hesitancy that we've seen in particular states, but even in pockets in communities here in California, I think people thought, oh, if I don't get vaccinated, that's my decision and that just impacts me. But what we're seeing now is really anybody who doesn't get vaccinated is also what we call a vector, right? And we know that this highly communicable virus is opportunistic and will evolve as quickly as possible. And we're seeing that already. So my anxiety is a little bit heightened, particularly as someone, with a compromised immune system. Mm-hmm. I am back on like masks all day, every day. Those are super important. I'm gonna, keep it a little bit on the down low until we know exactly, what the situation is with the vaccinations and with any potential booster shots, etc. And then at the back of my head, and actually at the forefront of my mind, is always the fact that we have a huge population that still can't get vaccinated, even if they wanted to. And those are our kids. And we have a responsibility to keep all of them safe. And so I kind of get in a lot of fights around masks at school. Like we do require masks at summer school. And I'm going to keep fighting those fights because it's 100% worth it for the safety of our kids.
And thank you for continuing to fight that fight and look out for our babies. So I have one last question for you, and it is the question I ask everyone who comes on this show because I'm an expert joy hunter. Where are you finding your joy today?
Honestly, it's being outside. So every morning, to kind of center myself, we take a 3-mile walk in the morning, and that's when we kind of catch up on our days, go over the days, etc. But particularly after last summer, and knowing and now having been part of fire response efforts 2 years in a row, I committed then, when we couldn't breathe outside and when it was not safe to be inside, to never, ever, ever take my mobility and my ability to breathe fresh air for granted. And so it's super small, but it's super big to me, just to be outside and be able to breathe fresh, clean air. I'm going to soak up every minute of it.
I love that. And I think a lot of us, that's the new mindset that we came out with, right? We've realized a lot of things that we appreciated and maybe that we taken for granted. For me, the water is the same way. Like, I'm like, I need to get out to the water because last year couldn't do it. I'm like you, I have the special edition immune system, so I couldn't.
Special edition, I like that.
I mean, you got to be careful how we talk to ourselves, So
I'm gonna take that with me. Thanks.
Absolutely. So I'll sit here and chat with you all day. We probably won't turn the webcam off, right? Like, but just thank you so much for joining us and for giving us this insight and for all that you've been doing out here, especially, California-wide, but especially from here in Sacramento and from someone who works in education as well. Like, thank you so much for what you do and what you continue to do.
Thank you. Thanks for building a space for people to tell their stories, tell their truth, for you to tell a little bit of truth too. I look forward to continuing the conversation, but thank you for having me.
The internet has been abuzz with arguments both for and against teaching critical race theory, which, despite its $10 name, basically just means teaching historically accurate history. But a lot of conservative folks are up in arms that teaching the realities of America's racist past somehow means teaching something anti-American. Well, here is General Mark Milley, the country's highest ranking general, defending the teaching of critical race theory at West Point.
America's top general firing back at Republican lawmakers on Capitol Hill over what West Point is teaching its cadets. Chief Washington correspondent Jonathan Karl has the latest on this. John, this was really something to see.
It sure was, Cecilia. In the face of an onslaught of criticism from Republicans, the Pentagon's top leaders forcefully defended the military's approach to dealing with racism and extremism.
On Capitol Hill, America's highest-ranking general weighed in on an emerging culture war. He was responding to Republican congressmen who slammed the Pentagon's top brass over the curriculum at West Point, accusing the academy of embracing divisive theories on race, pointing to one class in particular.
The seminar that over 100 cadets attended, titled Understanding Whiteness and White Rage, taught by a woman who described the Republican Party platform as a platform of white supremacy. This is going on at West Point as we speak to our future military leaders.
Milley's response invokes the January 6th riot at the U.S. Capitol.
I do think it's important, actually, for those of us in uniform to be open-minded and be widely read. And the United States Military Academy is a university. And it is important that we train and we understand. And I want to understand white rage, and I'm white, and I want to understand it. So what is it that caused thousands of people to assault this building and try to overturn the Constitution of the United States of America? What caused that? I want to find that out.
General went on to say there's nothing wrong with studying controversial ideas. In fact, it's important.
I've read Mao Zedong. I've read Karl Marx. I've read Lenin. That doesn't make me a communist. So what is wrong with understanding, having some situational understanding about the country for which we are here to defend? And I personally find it offensive that we are accusing the United States military, our general officers, our commissioned, non-commissioned officers of being, quote, woke or something else because we're studying some theories that are out there.
General Milley said it would be an especially bad idea to censor the study of America's troubled history on race. He said that understanding that, quote, matters to the discipline and cohesion of this military. Cecilia?
John Carl, thank you so much.
So we've all seen these vitamin supplement containers at the gas station, right? Wondered if there was any actual health value to them. What about the ones in the health section at the local drugstore? How much of what do those really do towards our general health? Our friends at Seeker put out this really informative video answering all those questions and breaking down the actual science of vitamin supplements.
Vitamin and mineral supplements are a $14.3 billion industry in the US. They're so popular, they're used by over a third of all Americans. But according to multiple studies, vitamin supplements don't actually improve our health. So why are we even taking them? It turns out the vitamin craze can be more or less attributed to one man, a scientist named Linus Pauling. Pauling won the Nobel Prize in Chemistry in 1954, was a founding father of molecular biology, and in 1970 wrote a widely influential book suggesting that vitamin C could prevent the common cold. The best-selling publication quadrupled sales for vitamin C, leading to what vitamin manufacturers called the Linus Pauling effect. But Pauling didn't stop at the cold. Later, he believed that vitamins could treat just about every disease, from the flu to cancer. These claims were featured in a Time magazine article in 1992, written by a health reporter who later claimed the issue was the year's bestseller. Pauling's reasoning for vitamins being a cure-all revolved around two basic things: antioxidants and free radicals. Free radicals come from our exposure to just about everything, from air pollutants to the oxidation process that happens when we metabolize our food. Free radicals are harmful molecules that are linked to aging and disease, but they can be neutralized by antioxidants. Antioxidants are naturally created in our bodies and can also be found in vitamins A, C, E, beta-carotene, and selenium. So the idea is that more vitamins leads to more antioxidants, which should lead to less disease. Unfortunately, when put to the test, numerous studies have concluded that vitamin supplements that supply antioxidants don't live up to Pauling's claims. In fact, some research has shown them to have adverse effects. One study of smokers in Finland found that subjects who were given beta-carotene supplements had an 8% higher mortality rate. A similar study in the US was even stopped after participants taking beta-carotene and vitamin A were discovered to be dying at rates 17% higher than those not taking them. But despite the bad news for vitamin supplements, we still need vitamins in our diet. And some people who may experience a vitamin deficiency can benefit from a supplement, like vitamin D for someone who lacks exposure to the sun. Pregnant women are also encouraged to take folic acid, otherwise known as vitamin B, because research has shown it lowers the risk of birth defects. But for most of us, experts argue that we should get our vitamins the old-fashioned way, through our food, which means eating things that are dense in nutrients, like fruits and vegetables. So before taking another multivitamin, maybe take a trip down the produce aisle instead.
And that brings us to the end of another episode of Masked Up, the internet's favorite community health live stream. We want to thank the half the internet that tunes in every week. We could not do it without y'all. My name is Andrew Defy. As always, shout out and big thanks to Netta, Allison, Atul, Esha, and the rest of the Protect Us crew. I'm just the face. Y'all are the heart and soul. Like Mozzie said, health is wealth, and I need my bag. Remember, health doesn't come from a pharmacy, y'all. Till next time.
Shout out to Dr. Pan, the man who got all this troublemaking started almost a decade ago. Thanks for leading the way and working to build a healthier Sacramento. Thank you, Senator.